so much for joining us once again. This is the third and final episode on our topic, knowing your contraceptive options. I believe that we've learned so much from the last two episodes, and so by now, if you haven't made your decision on which contraceptive type to go for, today is the day to do so. We are going to delve more into it with our midwives. I have my usual Auntie Julie with me here. And today there's a new addition. I have Auntie Araba joining us today. So she's also a midwife, and she's going to add her voice to the contraceptive topic so that we will be able to make informed choices. Don't forget that this program is supposed to be an interactive one. Join us, send in your comments, send in your questions. Our midwives here will be able to attend to all of them. And you can call us on 1221. You can WhatsApp us 050-166-1660. And you can reach us on all our social media platforms. And like I always say, share with your family and friends so that they can all join in the conversation and benefit from it. All right, Auntie Juliana, over the past two episodes, we've discussed the different types or methods of contraceptives. And let's talk about the duration, the short term and then the long term, for those who would want to make their decisions based on the duration. What are some of the short term contraceptives?
We have the pills. These are the pills. This one is daily pill.
Okay.
Then we have another pill.
Okay.
Yeah.
Okay.
So those who haven't seen the pill before,
Yes. Yes.
And then we have the injectable. This is Depo-Provera.
Okay.
It's a 3 months injectable.
All right.
Yes. And then this is the Press.
Okay.
It's also 3 months. This is the self-injection.
Oh, okay.
Yeah,
okay.
where the client can inject herself.
Yes.
And then we have the condoms, where we have the female condom.
So this is a female condom?
Yes.
Okay.
This is how it looks like. This is it.
Okay. All right, so this is the female condom. This is how it looks like. When you want to go in for a female condom, this is what to look out for. Right.
So male condoms too.
Okay. So basically these are the short-term methods. Yes. Right. Yes. So how long? The Press is 3 months. This one is 3 months, the Depo.
Yes.
And then the pill, one every day for the period that you would want to prevent pregnancy. All right. Auntie Araba, and so let's take us through the long-term methods. What are some of the long-term methods?
Okay, that's fine. For the long-term contraceptives, we have the IUDs. I said IUDs because we have two. We have the 12 years IUD and the 5 years IUD.
Okay.
Both IUDs are non-hormonal.
Okay.
It means it does not contain hormone. It's just have a special way of working to prevent pregnancy. So there is no drug in it to prevent pregnancy.
Okay.
And aside the IUDs too, we have the implants. The implants are rods, just like the size of a matchstick. So these are the implants. 2 rods go for a period of 5 years, and a single rod goes for a period of 3 years.
Oh, okay.
Okay, yeah. So for the 3 years implants, we have the implantal nest, and we also have the level plants.
Okay.
And the 5 years, we have the jadel. But for the level plants, it's also made up of 2 rods, just as jadel. But this time around, it lasts for a period of 3 years.
Oh, okay.
So these are the difference between the implants.
So if you want to go for a short term, we go for what Auntie Julie showed us, the condoms, the injectable, and the pills. If you would want to go for either the 3 years or the 5 years, it's the implant and the IUD. You can call us on 1221 and we'll give you further information about this. If you don't get confused of any of these, just reach out to us. You can also reach out to us on WhatsApp 050-166-1660, and then on all our social media platforms, and we would explain all these into details to you. Send in your comments as well so that you can join the conversation right away. All right. And you know that, some people have reservations towards contraceptives because of some of the side effects that they experience. So let's talk about, are there really side effects, or they are just misconceptions? Are there really side effects to family contraceptives, Auntie Juliana?
Yes, there are mild side effects which are manageable.
Okay.
So to start with, we have a lot, but then we'll mention a few, like headaches, nausea and vomiting, breast tenderness, mood swings, changes in bleeding pattern, and then all that. They are all manageable.
Okay.
Yeah.
All right. Yes. Auntie Araba, any more to add?
Yes, please. Okay, so to add to what Auntie Julie just said, with the headache and all that, those side effects is normally common, or it's common with the hormonal contraceptive. Now, if you look at the contraceptives we have here, if you take both condoms out, the rest of the contraceptives here are termed as hormonal contraceptives. So all the side effects she mentioned, headache, nausea, dizziness, are common with these range of contraceptives, including the long-term method implants. That's for the 3 years, the 5 years. It's also a hormonal contraceptive. So these are some of the things that you can experience from it. There is also weight changes when it comes to hormonal contraceptive use. And for weight changes, the individual can either gain weight or lose weight. It mostly depends on the lifestyle of the person. But in terms of the weight gain, it's not something that is outside the bracket or it's outrageous. It's something within your normal weight gain limits, depending on your normal body mass index. So if someone is gaining more weight or losing more weight, then it could be the person's lifestyle. The person may be leading a sedentary lifestyle, which can account for that.
Okay. But with the side effects, you mentioned that they are manageable, right? So how are some of the ways that you can manage them?
Okay, that's fine. Thank you for that. She mentioned the changes in bleeding pattern.
Yes.
If you take the changes in bleeding pattern, the person may either be bleeding longer days, shorter days, or heavy bleeding, or the person may be spotting. Now, for some people who will be having longer days of bleeding, that is 8 days and above, that is when we intervene. So for those people, they can call us.
Yes, they can call us. You can call us on 1221. Yes, I'll help you with that. You can reach us on WhatsApp 050-166-1660, and on all our social media platforms. We'll be able to assist you on how to manage it if you are bleeding more than 8 days, right?
Yes, please.
Yes.
Okay. And then also, some people may be spotting in between periods. Spotting too, it's manageable. And that one too, if they call the helpline, we can assist them to manage it.
Spotting is when you see
bleed in between periods, and basically it's spots of drop of blood. Sometimes it can't make a panty liner for about, let's say, something tiny in there. So this is spotting. And for the heavy bleeding, some people may be bleeding on your normal days, let's say 7 days bleeding or 5 days. But this time around, the bleeding is heavy. That one too, it's manageable. But you can just maintain it if you don't feel that you want to manage it and you are comfortable with it. That is okay.
All right.
But when it exceeds 8 days, you should contact us for us to help you.
All right. Okay. But what about the headaches? And can you take painkillers for the other ones that she mentioned? Nausea, vomiting.
Okay. Normally for nausea and the breast, some people even feel head lightedness and the like. We encourage them to take their pills at bedtime, especially with the daily oral medication, because if they take it during the daytime and they do experience the headache, the nausea and the things, when they are ready to go to bed, or it should be the last thing they take before they go to bed, so that phase that they will experience during the day fades out at night. Then when they wake up in the morning, they'll be refreshed.
All right.
So that is part of the management of the nausea and the things. But for the headache, it's not severe that you may want to take medication. But if you experience severe headache, we will encourage you to call our helpline for us to know more about what's happening, so that we can help intervene appropriately.
All right. But this is not to scare you, viewers. It is not everyone that experiences these side effects, right?
Yes, that's true.
Yes. It's not everyone. But if you do and you want to talk to us about this, you can call us on 1221, and you can also reach us on our social media platforms, and then on WhatsApp 050-166-1660. Let's help you manage those side effects, and so that you can also achieve your goal of preventing pregnancy. All right, Auntie Araba, so she's mentioned the side effects of the hormonal contraceptives. What about the non-hormonal, the IUD? Does it come with any side effects?
Okay, that's great. Yes, please. The IUD do have some side effects as well, just like any other contraceptives. So these are the IUD. We have the 12 years IUD here, and we have the 5 years IUD here. Both of them are non-hormonal contraceptive, as said earlier. Now, if you go in for an IUD, since it's a foreign material that you've introduced into your body, it will take time for your system to adjust to it.
Okay.
So during the first few days of insertion, you may experience lower abdominal pain or cramps, which is normal. By 7 days, it should fade off. Immediately after IUD insertion, some people do discharge, have some brownish secretion, which is normal as well, which can last between about 3 to 5 days, then it goes away.
Okay.
Now, during your menstrual flow, you may experience lower abdominal pain or cramps with IUD, which takes about 3 to 6 months for your system to adjust.
Oh, okay.
Now, if you are able to go through this phase, then you feel very happy about your method, because you won't feel anything. It won't have any hormonal effects on your system. If you feel like you've actually not inserted anything or you are on nothing, because it won't change your menstrual cycle. Okay. But what we do encourage is that people who have cramps during their menstrual flow shouldn't go in for IUD, because it may worsen their cramps.
Okay.
So these are some of the side effects one can experience on IUD.
All right. Okay. All right. So as I mentioned earlier, viewers, it's not everyone that is going to experience the side effects. You may be on the contraceptives and everything, your system will be normal, everything will be normal. You will not see any of the side effects or experience any of the side effects that have been listed here. However, for those who would or those who might experience, you're not going to have all the side effects at a go. You may just experience the headache or just the irregular menses. Yes, you're not going to experience all the side effects at a go, at a time. All right, so don't be too alarmed, don't be too worried. The side effects are very manageable. Just call us and we would have a conversation about it, on which one would be suitable for you. Auntie Juliana, there's this notion that contraceptives cause fibroid. How true is that?
Thank you. I would say it's not true. They are all misconceptions. They are myths about family planning, which people, I don't know whether they want to put fear in people not to access contraception, or I don't know. It's never true that it can cause fibroid. It rather reduces the chances of having the myomas, which is the fibroids, and then certain cancers pertaining to the uterus.
Yes. So contraceptives do not cause fibroid.
Cause fibroid.
Viewers, this is it. You heard it from the midwives. Contraceptives do not cause fibroids. Okay, so do not be misguided. call us and let's discuss which option would be best for you. Okay, do not be afraid of contraceptive causing fibroids. Now we have this question on one of our platforms. Khadija wants to know if you can get pregnant while you are on any of the contraceptives. Araba.
Oh, okay.
Is that possible to be like on any of these contraceptives and have a chance of getting pregnant?
Sure, it can happen. There is a chance for one getting pregnant though the person is on contraceptive.
How is
Normally, most of the contraceptives are about 99% effective. So the trace, which is 1%, you could be the one. But mostly what happened with it is that it's not necessarily about the percentage of its effectiveness, but then also some of the medication we take in and some of the herbal preparation we take in. For the hormonal contraceptives, that's the implants through to the 3-month injections and the pills. They are hormones, and as we mentioned earlier, they are drugs which goes into our system, mixes with our blood and take effect. Now, if you're on any medication, for instance, the epileptic drugs and other ones, it has the tendency to reduce the efficacy of the hormonal contraceptive together with other medications. That is why it's advisable to let your provider know if you're on any medication before you sign up for any of the methods. Also, herbal preparations. The herbal preparation, you get some herbs, you boil them, you don't even know what goes into the contents, then you take about 2 glasses every morning. It also has the tendency to reduce the efficacy of hormonal contraceptive. So 2 things: either the hormone reduces the efficacy of the drug you are taking in to manage your condition, or the drug you are taking in to manage one condition reduces the efficacy of the drug. So we encourage all people and women and girls who are on any form of treatment to inform their providers that these are the drugs that they are on and how best can it work for them, or how best is it going to affect their choice of contraception.
All right, so yes, you can call us on 1221 or on our social media platforms, Facebook, WhatsApp, on Twitter at Lydia Contraceptives. You can reach us on 050-166-1660. That's on WhatsApp. We would be able to tell if the medication you are on is going to affect the contraceptive you are on. So if you are taking any medication and you are worried about being on a contraceptive as well, let us know and we'll be able to help you make that decision. All right. Okay. So there's also this issue about infertility. Contraceptives causing infertility. A lot of people are afraid to use them because they think that when you get on contraceptives, it affects your fertility and you won't be able to have children in the future. Auntie Juliana, is this true?
I would say no. You know, as Araba said, the drugs are hormonals. You take the IUDs out, the rest are hormonal. And then every drug has its time of return to fertility when it comes to an individual. If I take it, for instance, if I take the daily pills, if return to fertility is maybe 1 month, it will differ from my sister here. So it doesn't cause infertility, but return to fertility may delay depending on the drug you are using. Yes.
All right.
Okay, so to add up to what Auntie Julie just said, each of the hormonal contraceptive has their own duration. For instance, we have the short term and the long term. Now, if you intend to abuse, I use the word abuse because some people want to be on the contraceptive for a very long time, let's say 3 years, 4 years. Then they'll go in for the short term contraceptive. For instance, the 3-month injection, and they'll take it for a long period of time. Now they are ready to conceive and they will be having challenges with it. For injectables especially, if you use it for a very long time and you stop, return to fertility can take about a year. So without a whole year, you'll be battling with, it's because of the family planning. But if you use it appropriately for what it's designed for, you have the whole benefit of it.
All right, so we have another question in our inbox. Fred is asking, can contraceptives cause cervical cancer? All right, I think this is also a very familiar question. We have a lot of questions about cervical cancer and contraceptives. Auntie Juliana, can it?
No.
Yeah, it's true. It can't cause cervical cancer. Now, there are a wide difference between cervical cancer and hormonal contraceptive. For one to have a cervical cancer, there should be a growth. It's a growth. It's a change in the growth of the layers of the cervix, which will lead to the cancer or carcinoma. But mostly people are predisposed to a different virus that causes or that may speed up the cause of the cervical cancer. That's the human papilloma virus, which is a different thing. So this is a virus or something that causes infection or deformity to the cervix. But this time around, these are different. These are contraceptives, which goes into the system to work. Actually, these contraceptives are not strange to the female body. We have both hormones in us, and the same both hormones are used in preparing this medication. So these are not prepared to cause any form of infection or virus to the system. So contraceptives cannot cause cervical cancer.
All right, so Fred, there you have it. Contraceptives do not cause cervical cancer. All right, so do not let it limit you or your partner on choosing any of the contraceptive methods. All right, so but then there's also this misconception about the IUD. It has this copper around it. Yes, because you are going to have it in your body for a long period of time. People think that it's able to rust while it's inside you and can cause some other harmful effects or something. Is that possible?
Okay. No, please. The copper coiled around this plastic rod do not rust, and when it's in the womb, it's safe. It's a medicated copper which produces a reaction to destroy sperms once sperms comes into contact with it. Although it's shiny as you see here, on removal, it won't be this shiny because it has come into contact with secretions in your womb. So it won't be this shiny as you see here, but it doesn't mean that it will rust or at the time of removal, you will see a rust on it. No. As it goes in there, it comes out the same without causing any damage or deformity to your womb when it's inserted.
All right, so all these are just misconceptions. If you want to go in for the IUD, it's safe and it's convenient as well. So you can call us and we'll assist you with a health facility where you can have it done. Do not be misguided. All right, I want us to move a bit away from the side effects, and let's go back to the daily pill. Okay. It's possible that sometimes you can miss a pill. I want us to, delve more into it. How do you manage that? If you've missed the pill, what happens? Auntie Juliana.
Yes. Okay. And this is the pill.
Yes.
So it's a daily pill that you're supposed to take. So in case you forget today, as soon as you remember, you have to take the one you forgot to take. Before you take today's own at the time that is due.
Yes. Okay.
So once you forget and then you remember, at that time, take the one you've forgotten before you take that day's own.
Okay. Yes, I do. Because we are supposed to take it at the same time, right? We are supposed to take it at the same time. So if you are taking it at 7 a.m., it means that every day at 7 a.m. you take one pill. So let's say it's like 12 p.m. now and you just remembered. It means that you can take it.
Yes.
And then when the time is due for the next pill, you can take the next pill as well, right? Right. So let's say you forgot for a whole day, Auntie Araba. You are supposed to take it at 7 a.m. You forgot. You forgot on Monday, and then now it's Tuesday. It's almost 7. Let's say you woke up at 5. Oh, maybe if you are there, 5 a.m. What do you do?
Okay, so you still take that pill at 5 a.m. and when it's 7 a.m. that same day, you repeat a pill. Okay. That's for the day's pill. Okay. Now, if you take the daily oral pill, it's made up of lines, 4 lines, yes, 3 white lines and 1 brown line. If you miss a pill in any of the white portion, as soon as you remember, you take it and you continue on your pill intake, just as Auntie Julie said. But when it happens that you miss 3 or more pill in either this line or this line, that's the second or the
second and the third line.
You take a pill as soon as you remember. Okay. But if you've engaged in unprotected sexual intercourse in the last 5 days, then you take a post pill while you are still on this pill. Okay. But you, assuming you didn't engage in any unprotected sexual intercourse, you still take your pill and you continue on your subsequent pill intake. Okay. But because there was a break for about 3 days or over, it's assumed that you are now starting the pill. So you have to wait for 7 days before you engage in unprotected sexual acts. Okay. Or you use a backup method such as condom.
All right. So, well, this is how you're going to manage if you've missed any of the pills. Yes. So if you've missed more than 3, it's assumed that you are now starting afresh. So the 7-day rule applies. Do not forget about that. But let's try and follow the time. Let's try to stick to the time that we select to take the pill so that we avoid all these inconveniences. Do get in touch with us. Send in your comments. Call us on 1221. You can reach us 050-166-1660 on our WhatsApp, and then on all our social media platforms at Lydia Contraceptives on Instagram, Facebook, and Twitter. We would have to bring the conversation to an end now, but if you have any further questions or comments or any experience you would like us to discuss, you can send in them to our platforms as I've mentioned earlier, and we'll continue the conversation. I would like to thank my midwives, Auntie Araba and Auntie Juliana. Today, Auntie Rita couldn't join us, but that's okay. We've also been very well informed by Auntie Araba. So until we make a date another time, it's bye-bye from your Lydia Contact Center.
Bye.
Yeah.